Now there's another form of immunotherapy that's been coming out, and this is called sublingual immunotherapy, or SLIT. So this is a different form of immunotherapy where you take this aqueous extract of allergen and you drop it under the tongue and you hold it for a period of time and then you swallow it. So this is a different mode of delivery. Instead of getting a shot, you put a drop of extract under the tongue. So it's taken up by the vascular and lymphoid network of the mouth, and the majority of studies that have looked at the SLIT studies has looked at single pollen allergens in patients with allergic rhinitis. So it's not currently approved by the FDA, and there's no commercially available allergen preparations that have been approved by the FDA. So typically how this form works is you give escalating doses daily, typically before the pollen season starts, and maintenance dose in the studies have reported reaching it between 3 to 12 weeks of treatment. Once you've reached that maintenance dose, you can give it daily to weekly. So it's varied a lot in the studies on how frequently they're giving it. And what they found is for efficacy, in especially these single pollen studies, is the dose that you need to reach a therapeutic response is usually 20 to 200 times greater than what you would need with subcutaneous immunotherapy. So you need a lot more to see a response with this form of immunotherapy. So some studies have shown that there is improvement in rhinoconjunctivitis and asthma symptoms with single allergen extracts. It's certainly more convenient, you can just get a drop under the tongue rather than getting a shot, and there's been less systemic reactions reported with this form of immunotherapy. Now there's certainly potential side effects. People have reported oral, ear, throat itching, oral swelling, and that's been reported in up to 50% of patients because obviously you're giving it in a mode of delivery in this fashion. There have been a few reported cases of anaphylaxis, although that's been rare. And then there's also been reported cases of eosinophilic esophagitis. And this is a really tough disease, I think, to manage and deal with. And these patients can get like strictures in their esophagus, choke on their food. And so, they have reported this in this form of immunotherapy. So that's certainly a concern because it's a very, very tough disease, I think, to treat. And so they think that this may happen because of the allergy causing some type of delayed mediated cell response in the esophagus. And so because of this form is going through the oral route, obviously there's been a big concern about people potentially developing EE with this. So a lot of the research is still kind of pending and trying to figure out, what's the optimal duration of therapy to actually reach an immunologic change and clinical benefit. So that hasn't been really well defined. There's been years and years of data and studies with subcutaneous immunotherapy going far back, 50 plus years ago, and that's how we've reached kind of these guidelines of, you should do for like 3 to 5 years, for example, of therapy. But it's not clear how long are you supposed to do this form for, and so research is still kind of pending on what really would be the optimal duration of therapy in this form of immunotherapy. So part of the problem with sublingual and the research studies is they looked at a lot of studies with just using like one allergen, and most of our patients who are getting allergy shots are sensitized to way more than just one allergen. I mean, there are multiple allergens. So they haven't quite figured out like how can you give SLIT in a multi-allergen form. So for example, you don't have to take, say, 20 different droplet bottles and just say, for example, do it in just 1 or 2. How do you combine them and make it efficacious? So a lot of the studies, at least in the US, have shown that it has not demonstrated a clinical benefit with this multi-allergen SLIT form. So I think that's a big reason why it hasn't been approved by the FDA, is there still hasn't been research showing that it works really well with multi-allergen immunotherapy. And that's really most of the patients is, more than just one allergen, obviously, you're treating.